Have you ever heard stories about what should happen after surgery? When you can go home, what you should be eating, or whether you need to wait for certain milestones before you're discharged. A lot of what patients believe about surgical recovery is completely wrong. Today, I'm breaking down the biggest myths about post-surgery recovery that could truly shock you, and I'll give you 5 important truths that you must know to keep yourself and your loved ones safe. Let's get started. Myth number 1. You'll be pain-free when you go home. Well, this is one of the most common misconceptions. The goal of the surgical team is not to make you pain-free before discharge. The goal is to make your pain manageable enough so that you can move safely, perform basic activities of daily living, shower, dress, or go to the bathroom, walk around your home, and function without unsafe levels of discomfort. Pain after surgery is expected, even with perfect technique. Tissue has been cut, moved, or repaired. Your body needs time. If you're being discharged home, it means your pain is controlled enough with oral medications, and you are safe to function independently. Or, if you're discharged to a facility, your pain is controlled enough for you to continue therapy and participate in rehabilitation. Pain-free is not realistic. Functional and safe is the actual standard. Myth number 2. We must wait for your bowel function before you can go home. Well, this one depends heavily on the type of surgery. For colorectal or bowel resections or surgeries involving your guts, yes, we monitor bowel function. And what we're actually waiting for is flatus, the return of gas, not a full bowel movement. But for many other surgeries, such as hernias, gallbladders, appendectomies, and most laparoscopic operations, we actually don't need to wait for bowel function to discharge you. Your gut naturally slows down after anesthesia, but as long as you're not vomiting, not bloated, and tolerating a basic diet, waiting for bowel movement is not necessary. Myth number 3. You have to wait until your wounds heal before you leave the hospital. Well, surgical wounds do not need to be fully healed before discharge. If a wound is closed, you go home with instructions on how to care for it. If a wound is open, for example, packed, dressed, or intentionally left open to heal from the inside out, you still go home with a wound care plan. This may include dressing changes taught to the family, a caregiver performing the wound care, or coordination with home health for regular visits. Healing takes days to weeks. The hospital is not where wound healing happens. It happens home with the right plan. Myth number 4. You must be eating normal food before you get discharged. Not every surgery allows you to immediately return to a regular diet. In fact, certain operations, like upper GI surgery, pancreatic or esophageal procedures, or bowel obstruction repair, eating normally too soon can be dangerous. When we discharge you, the goal is adequate nutritional intake, not a normal diet. You may go home on flavored liquids, protein shakes, or soft foods, or, if needed, we coordinate enteral access like a feeding tube. In rare cases, parenteral nutrition, where nutrition is given through a line, is sometimes performed. Nutrition is essential, but the form you receive it depends on the type of surgery. Regular food is not the requirement. Safe nutrition is. Now to the last myth. Myth number 5. You can't go home until your infection is completely treated. This is a big one. You don't need to stay in the hospital until every lost drop of infection is gone. The real goal is that your infection is controlled, your vital signs are stable, you have no fever, no signs of sepsis, and your body is responding to treatment. Antibiotics, they often continue at home. This can be oral medications, or for more serious infections, IV antibiotics through a peripheral or central line. Hospitals are stabilizing you. Finishing the treatment is usually done as an outpatient. Let's actually move to the 5 truths you must know about surgical recovery. Make sure you wait for the last one because that's something that you really have to pay attention to. Truth number 1. You cannot go home if you still have a fever. A fever means the underlying issue is not controlled. This could mean ongoing infection, poorly drained abscesses, pneumonia, urinary tract infection, or postoperative complications. You need improvement before you're safe to leave. Truth number 2. You can go home with IV lines if they're the right kind. Patients often think they must be fully disconnected before discharge. Not true. You cannot go home with IV pole and fluids running, but you can go home with peripheral or short-term IV antibiotics and a PICC or a central line for long-term treatment. This is common and safe when supervised correctly. Third one, you cannot drive yourself home after outpatient anesthesia. Even if you feel fine, your reaction time, judgment, and reflexes are impaired. Insurance won't allow it, hospitals won't allow it, your surgeon won't allow it. You must have a responsible adult to take you home. Fourth one, you cannot return to work or drive while taking narcotics. Narcotics impair your coordination, your focus, your reaction speed, and ability to make decisions quickly. This is unsafe for you or others, and once you're off narcotics and functioning safely, now you may return. For the final truth, recovery is not just medical, it's functional. The true measure of whether you're ready to go home is whether you can walk safely, eat enough to sustain healing, manage pain with oral medications, stay hydrated, and monitor warning signs. Recovery isn't just about numbers in the chart, it's about safety performing life again. Surgical recovery is full of myths, and believing the wrong ones can cause unnecessary fear, confusion, or delays. If you want more videos like this, please click the like and subscribe button, and check out our other videos and type your questions down in the chat, and I'll see you guys next time.